Guys, it's Jan King here. Just woke up. I'm just gonna cover the last few chapters. Hopefully it'll reach you guys when you guys get to the competition. So let's keep going. So chapter 13 is on psychiatric disorders. So these are mostly just the anxiety disorders, the mood disorders. So I'm just gonna go through a couple of them. So let's start with OCD. So OCD, the main symptoms: people get trapped in repetitive thoughts, behaviors. They know it's it's something that it's groundless, but they can't really stop it. People who repeatedly wash their hands, check that doors are locked, stoves are turned off, they walk around the building a couple times before they enter it. These are all OCD type conditions, and neuroscientists think that there could be both genetics and environmental factors playing out here, and actually when they look at PET scans, they actually found abnormalities in cortical areas and deeper areas of the brain. So there are actually abnormal anatomical things in OCD patients. So when people treat OCD, they mainly use SSRIs. That's a name that you're going to be hearing really frequently inside of chapter 13. Notably, they use clomipramine, sertraline, and paroxetine. So they also use exposure and response prevention. That's a behavioral kind of therapy, and that also works. The next disease I want to talk about is phobias. You guys, it's pretty much evident what phobias are. Fear disorders. So you fear something abnormally. You use SSRIs for those too. And they also use cognitive behavioral therapy. That's also good. Now, the next disease I want to talk about is depression. Depression has a lot of can be actually pretty crippling. Essentially, your emotional well-being is reduced. You have a loss of interest in life, a very pessimistic outlook. Actually, and with this, you get a lot of physical symptoms as well, like decreased energy, disturbances in sleep and appetite. When we look at people with depression, we see that a lot of them fail to shut off cortisol, and actually, when we look at PET scans, we've also seen some abnormalities in the anterior cingulate gyrus. So when we treat depression, usually we just use SSRIs. We want to increase the levels of serotonin or norepinephrine at the synapses, and SSRIs have shown to be pretty effective. Sorry, I gotta blow my nose. So the next disease I want to talk about is Tourette syndrome. Tourette syndrome, essentially you have some abnormal activity in the basal ganglia, and as a result you get some kind of involuntary movements or tics. That's the main symptom of Tourette's. These can be vocal tics or physical tics. They're rapid, they're sudden, they're persistent. So when people try to treat these, they usually use SSRIs, and also people have seen that using methylphenidate, which is used for ADHD, also works for Tourette's, so that's good. PTSD. Now, PTSD is post-traumatic stress disorder. Essentially, after you suffer extreme trauma, you can essentially be scarred for a lifetime, and you have a sense of intense fear or horror, or you have really, really intense recollections of a particular traumatic event. You can't, so your stress hormones, you can't regulate them properly, so you suffer a lot of sleep disorders and major depressive disorder. So usually people find that very high levels of norepinephrine are elevated inside the brain in patients with PTSD. And so to treat this disorder, people use alpha-1 blockers, such as prazosin, and beta blockers, such as propranolol, have also been proven to be effective. So so the final disease I want to talk about is bipolar disorder. Bipolar disorder is also called manic depressive illness. So essentially you swing between moods of depression, where you have a lot of symptoms of major depression, but then you go into symptoms of mania as well. So you have increased energy, a decreased need for sleep, a marked interest in goal-directed activities, poor judgment. So the main cure for bipolar disease, I want you guys to know, is lithium. Lithium is used to treat bipolar disorder, and recently they've also discovered some anticonvulsant drugs that might also be helpful as well, such as valproate. And bipolar disorder is highly genetic, and that's another thing you have to know. That's something that sets this disease apart. So the final disease I want to leave you guys with in chapter 13 is schizophrenia. Schizophrenia, you have disturbances in thinking and cognition, and usually this is due to an excess of dopamine. And also, when you look at the scans, people have also found that the ventricle areas, something could be wrong with those areas as well. Like the ventricles are enlarged or something. And if you guys don't know, ventricles are essentially the gaps inside your brain filled with cerebrospinal fluid. So to cure this disease, the first antipsychotic drug, chlorpromazine, was discovered in the 1950s. They use it to cure schizophrenia. However, there was a problem with the first generation of antipsychotic drugs. Remember, schizophrenia happens due to an excess of dopamine. When you try to reduce that dopamine, you may end up reducing too much, and that's exactly what happened with the first generation drugs. So a lot of people develop side effects similar to that of Parkinson's. So the second generation antipsychotic medications seem to be more effective in dealing with these kind of dealing with schizophrenia without triggering Parkinsonian symptoms. However, there are other things that can happen as well. Very large weight gain, blood disorders, muscle pain. So people have to keep that in mind when they take medication for schizophrenia. These diseases, of course, they're not like neurodegenerative disorders, but they're just as dangerous. They're just as much of a problem, and raising awareness about mental illness is really important. So I hope you guys emerge from this chapter a little bit more aware about what happens in these individuals. Thanks, guys.